If you're a woman watching this video, especially those with dense breasts and or those who identify as Black, if you're 40 years or older, please consider initiating breast cancer screening conversation with your PCP. In epidemiology, incidence is simply the number of new cases during a period of time. Cancer incidence in females goes from breast cancer, lung cancer, colorectal cancer in that order. The incidence rate of breast cancer in recent years has declined by 0.5% per year. Breast cancer is the second leading cause of death in women, and the probability that a woman will die from breast cancer is about 2.5%. Lung cancer, on the other hand, is the leading cause of cancer deaths in both men and women. According to the American Cancer Society, there has been an overall decrease in breast cancer deaths of about 43% between 1989 to 2020. The decline has been attributed to proper screening, increased awareness, and better treatment, even though the rate of decline has slowed in recent years. The focus of today's video is breast cancer screening. Hi, it's Dr. Frederick Acquah, third-year internal medicine resident. If you're new here, don't forget to subscribe. Let's go. Welcome back. I'll begin by saying that every organization or society has on their board distinguished people who meet from time to time and come up with guidelines which are later recommended to the public. Examples include the National Comprehensive Cancer Network, the American Cancer Society, the United States Preventive Services Task Force, the Center for Disease Control, and others. Unless it was recently changed, I do remember on the USMLE's, the United States Licensing, Medical Licensing Exam, we were tested on guidelines provided by the United States Preventive Service Task Force, USPSTF. The USPSTF is an independent body made of 16 national experts in disease prevention and evidence-based medicine who volunteered their time to review the research on specific preventative service and provide evidence-based recommendations. In areas where data is inconclusive, they report to Congress on priority research gaps. Recommendations made are categorized in grades. As you can see on your screen, we have grade A and B are usually what primary care physicians recommend to their patients. Grade C recommendations for specific patients depending on their individual circumstance. The task force recommend against grade D, and I see grade I as insufficient evidence to make recommendations. Between 2000 and 2015, there were several debates on when screening mammography should begin due to a number of large studies. In 2016, the USPSTF recommended screening mammography for women aged 50 to 74 years old every 2 years as a grade B recommendation. Let's see the video on the latest recommendation, which is currently in progress. So this has not been published yet. I just want to make it clear, it's still in progress.
Breast cancer impacts far too many people in our country, and we have long known that screening for breast cancer saves lives. Now, more inclusive science has shown us that all women should be screened for breast cancer every other year starting at age 40. Black women are 40% more likely to die from breast cancer than white women if they get it. They also are more likely to get more aggressive forms of breast cancer. So this recommendation is particularly critical for Black women. We still need more scientific evidence to help us understand whether and how additional screening could help the 40% of women in our country with dense breasts. We also need more information to better understand how to address health disparities. And we need information about the benefits and harms of breast cancer screening in women over the age of 75. But for now, the most important thing for women to know is to begin screening at the age of 40 because it just might save your life.
This recommendation is open to public comment until June 6, 2023. So if you have any comments, please follow the link in the description box below. So I repeat, if you're a woman, 40 years and older, you have dense breast, you identify as Black, please try initiating the conversation on breast cancer screening with your PCP. I'll conclude by saying that at the time of recording this video, there are about 4 million breast cancer survivors in the United States. My recommendation, get your mammography done if you meet the guideline. I'll see you in my next video. Shalom.